Hi, my name is Jocelyn Luzardo. I am going to talk about framing of Fabry disease with the pharmacologic chaperone Migalastat. Definition. Fabry disease is a rare genetic disorder that prevents the body from making an enzyme called alpha-galactosidase 8. This enzyme is responsible for breaking down a type of fat called globo-triacylceramide into building blocks that the body cells can use.
What is Fabry disease? Fabry disease is an X-linked lysosomal storage disorder. Mutations of the X chromosome result in deficiency of the lysosomal enzyme alpha-galactosidase A. Lysosomes function as the recycling centers of the cell. They contain digestive enzymes that break down substances into smaller compounds. Deficiency in this enzyme results in progressive accumulation of globo-triacylceramide in lysosomes, leading to organ damage and premature death in men and women. This disease causes progressive damage to different organs and tissues. As this is a rare disease, with such a wide range of symptoms, it is frequently misdiagnosed. Genetic inheritance. As the condition is caused by a DNA mutation, it is a genetic disease and therefore hereditary. Fabry disease is an X-linked disease, which means that transmission is linked to gender as follows. As family members may be affected, even if they don't have obvious symptoms, it is very important to perform pedigree analysis and test relatives for Fabry disease when a diagnosis of Fabry disease has been confirmed. Fabry disease and women. In men, symptoms generally appear at an earlier age, are typically more severe, and progress more quickly than in women. Women affected by Fabry disease normally become symptomatic when they are adults. The symptoms are less severe than in men, which is why female patients are often misdiagnosed. Signs and symptoms. Early symptoms of Fabry disease often appear in childhood and include acute pain in the extremities, fatigue, intolerance of physical exertion, hyperhidrosis, gastrointestinal problems, and angiokeratoma. Patients with Fabry disease are also particularly affected by sudden changes in temperature or extreme temperatures. Symptoms that can be present in a large proportion of patients with Fabry disease include stress and fever. However, Fabry disease affects different organs, which require specific treatment. Disease progression leads to a variety of systemic manifestations, including manifestations of the nervous system, kidneys, eyes, skin, gastrointestinal tract, and heart. In addition to physical symptoms, many patients with Fabry disease also suffer from depression, which is caused by factors such as decreased quality of life. Also,
Application in medicine. Binding of the pharmacologic chaperone Migalastat to the active site of a galactosidase stabilizes certain mutant enzymes, thus facilitating proper trafficking to lysosomes, where dissociation of Migalastat allows a galactosidase to catabolize accumulate substrate. Pros and cons. Pros. The higher volume of distribution of Migalastat depth of recombinant galactosidase hints at the possibility of better diffusion in organs and tissues. Cons. This disease causes pains in the extremities, decrease or absence or swelling, vascular lesion, different types of heart disease, such as ventricular hypertrophy, severely affect the kidney, leading to the kidney failure. Issue applied in Ecuador. The Sanofi Hansamai Ecuador company has reported that in the country there are 7 patients with a confirmed diagnosis of Fabry disease, making it an extremely rare disease in our country. Conclusion. Among all randomly assigned patients, the percent of patients who have a response at 6 months that not differ significantly between the Migalastat group and the placebo group. Patients with renal disease should have a similar evaluation plus estimation of the GFR and a unit protein to creatinine ratio every 3 months to 6 months.
Fabry is a disease that's caused by a deficiency in one of the enzymes that are responsible for recycling cells in the body. It's carried on the X chromosome, and carrier females have a much milder disease usually than the fully affected males. Males can have a severe picture of neurologic pain, which leads to a feeling of burning, usually in the hands and the feet. Males can also have problems with the kidneys, which fail over time and can lead to the need for dialysis and eventually renal transplant. They also can have a cardiomyopathy that can be severe enough to ultimately require cardiac transplant. In females, the symptoms can be similar, but they're usually milder and later in onset. Fortunately, we have enzyme replacement therapy. For most patients, the enzyme infusions are effective in stopping progression of the disease and in most cases even causing improvement in the symptoms. We also have ready access to the clinical trials that are going on, many of which are happening here at the Center for Rare Disease Therapy. And so we can work with families to help them understand what might be the best option for them.